Welcome to the podcast Collaboration Over Competition. Today we're doing a special podcast. We're here in New York City, and I'm so honored to have Dr. Lara Devgan with us. She's a board-certified plastic surgeon that specializes, yes, in surgery, but also in injectable and skincare. Thank you, Lara, for having me in your beautiful clinic.
Thank you so much. I'm so excited and happy to have you.
And we're going to talk today about a really interesting and really hot topic, skincare and injectable. So you're world known for your skincare line, but how did it start? What motivated you at the beginning to start your own skincare line?
Plastic surgery is such an amazing field, but I think it's very important to be fully vertically integrated with the type of care that we give to patients, because we don't want to be in a situation where you're getting your teeth whitened at the dentist twice a year, but you're not brushing them every day at home. And so the opportunity to help people with clinically validated, evidence-backed medical grade ingredients used in a consistent daily way is something that I saw as a white space. So we initially launched the skincare line in 2019, 2020, and have since grown steadily over the course of the past 4 years. And it's been a really amazing journey, because I think we really hope to achieve a level of clinical evidence, not only in our facelifts and breast augmentations, but also in our Botox and injectables, and then also in our clinical skincare. So that's the little bit of the reasoning and story behind this.
And at what age should we start skincare? Should we start like when we're 12, when we're 40?
Obviously, over time, with the hormonal milieu and the change in homeostasis in the skin, we're seeing different things. In the teen years, a lot of the care is regarding sun protection and acne homeostasis and maintenance. As we get into the 20s, it's important to start thinking about using a vitamin CBE ferulic serum. In the late 20s, maybe a retinol bakuchiol, hyaluronic serum. Into the late 30s and 40s, we start thinking about hydration and breakdown of the skin barrier. So a peptide eye cream, a niacin squalene net cream. In the 50s and beyond, in the perimenopausal age range, when we're thinking about loss of elastin and collagen in the skin, more replenishment. So, there's not one hammer for every single nail, and there's not one skincare product for every single person. But the idea of using this huge, vast database of clinical trials and clinical evidence to have some topicals for our dermis is important.
And then skincare are getting, the line are getting better and better. Do you think that one day skincare is gonna completely replace injectable?
I think that right now, no topical is as good as an injectable, and no injectable is as good as a surgery. And I think
that's a good answer.
That expectation management and kind of being a little realistic about what you put into something and what you get out of it is very important, because nothing drives me crazier than seeing creams that say they're a facelift in a bottle. A facelift is a facelift and a bottle is a bottle. But that being said, I do think that as we're thinking about environmental exposures, protection against oxidative stress and damage to the skin, and thinking about aging at the molecular and cellular level, we can improve the endpoints that we achieve with the same types of procedures. And in some cases, we can delay or defer the need for certain types of procedures. So it's all a big picture. There's no clear, bright line. My whole office is gray because I think that beauty really exists in the gray area as sort of a balance. It's a metaphor, right? There's so much nuance that is lost when we have these fights over what's better, filler or facelift, or do you really need this cream or not? It's a continuum.
Exactly. And I think right now, as an injector, I'm trying to stay away from overfilled face, or as we call pillow face. Do you have other option for your patient? What are you telling your patient when they don't want that overfilled look?
I think the concept that I think about in my practice is adherence to the undetectable. And so you don't want to think about any product, whether it's filler, Botox, sutures, really anything in our armamentarium. You don't want to think about it as how much you can do, but you want to think about it as the least that is needed to make somebody happy. And we have this ladder of interventions. I often tell my patients that the way we can avoid a pillow face look is not by avoiding the concept of volume loss or volume loss replacement, but it's by thinking about judicious anatomy directed placement of products.
I think the anatomy is really a key word in that.
Absolutely, yeah. It's like a glass of water evaporating. If only 1 ounce is missing, the waiter at the nice restaurant only gives you 1 ounce. You don't put 8 ounces of water in a glass and get it spilling all over the tablecloth. And you don't stuff as much filler into the face as you can conceivably fit, because that's just not how we think about what's aesthetic.
And I don't think it's right.
It's not right for the patient. It's not ethical. It doesn't look good. Nobody's happy. So we want to always be operating at the highest, best, most beautiful part of our possibilities curve.
And what do you think is the biggest misconception about cosmetic procedure?
I think the biggest misconception about plastic surgery and cosmetic procedures is that they have to look unnatural. We are all so worried about the appearance of the surgeon's hands on someone's face. We've all been overly accustomed to dysmorphic, distorted, uncanny valley faces that are overly tight, overly pulled. And I think there's something that's unbeautiful about that, because it looks like you are trying to gild a lily or mess with nature. So the best work is undetectable, and the biggest misconception is that work has to look grotesque or obvious.
That's exactly what I'm trying to move forward in plastic surgery, that it can still look like you, just a better version of yourself.
Yeah, I think that's so important, because ultimately what we do is not even appearance based. It's really about confidence, and it's about helping people make sure that their external identity matches their internal feelings.
Yeah, exactly.
And so I think kind of centering it around something that feels more positive and affirmative is great.
And the last question that I ask everyone on my podcast: if you can stay at one age for the rest of your life, which age would you pick?
That is a great question. I think that we want to be getting better and better over time. In some theoretical world, you want the last age you're at to be the best one, because you've learned from all the accrued years before. I'm pretty happy right now. I think the 40s are a pretty nice decade. I feel like I've hit my stride professionally. I feel happy that I have a family. I feel happy that I have a nice husband, successful practice.
This beautiful office.
Thank you. So, I mean, knock on wood, I don't want to jinx anything, but I feel pretty good right now. If I can continue to have this feeling and the maturation and wisdom of time, then I will look forward to aging.
Well, that's it for the podcast of the day. Thank you for your welcoming and your nice office. We had Dr. Lara Devgan in New York City. And stay tuned for the next podcast.
Thank you so much. This is such a pleasure.
Thank you.